Hello, good evening. Thank you very much for your time. We're happy to have all of you here. So my name is Joel Lontsi. I'm a data scientist at Zindi, and we are here for a webinar on the Multilingual Health Question Answering in Low Source African Language Challenge by Makerere University and the other partners, including ITU. So thank you very much for showing up. I'm going to, as you all know, Zindi is a data science platform where people can participate in competition and they can participate in competition, win prizes, build a relationship because they can work in teams, obviously, and they can, and they learn and they grow their skills. So that's what Zindi is about, and we are always happy to collaborate with different partner research institutions and industry to bring challenges that are interesting to our participant. Yeah, I think that's basically about it. I think I would now I will give the floor to Dr. Elizabeth Oseku. She is the project coordinator for the. Sorry. Oh, the meeting is being transcribed. Okay. Right. Okay, yeah, so as I was saying, I will now give the floor to Dr. Elizabeth Oseku. She's the project coordinator for the HASH. She's the project coordinator at HASH, and she will briefly introduce what HASH is all about and give you an idea of the kind of project they're working on and how this all fit in. Okay, thank you. Dr. Elizabeth, the floor is yours.
Hey, thank you very much. Good morning, good afternoon, good evening, everybody, wherever you are. Thank you for joining this call today. It's nice to see a couple of familiar people here. Thank you very much for your interest in this Zindi challenge. And so my role here today is really just to let you know what HASH is and why we think that the work that you're signing up for in this challenge, or the work that you're interested in signing up for in this challenge, is important and worth doing. We'd also like to share a bit about the work that we do, and hopefully from here you can be interested in following us and the work that and the other things that we have planned to do in the future. So I'll just share my screen. I can't share my screen, unfortunately. It says disabled.
Okay, yeah, I think I will make you co-host and then you will be able to share. Okay. Yeah, now you should be able to share.
Okay, yes. All right. Okay, just a moment. Okay, I hope you can see that. I'm just going to go into presentation mode. Please confirm that you can see.
Yes, we can see it.
Okay, all right. Okay, so my name is Dr. Elizabeth Oseku. I'm a medical doctor and a public health specialist. I work as a project coordinator for the Hub for Artificial Intelligence in Maternal, Sexual and Reproductive Health. We are called HASH for short. So what is HASH? HASH is a research hub and a network for artificial intelligence in maternal, sexual, and reproductive health. Now, that is a mouthful. So for this presentation, I will be calling it MSRH. But we are a research hub and network for MSRH. We've been working in this space of AI since 2021, and we are a consortium of 3 Ugandan partners, the Infectious Diseases Institute, Sunbird AI, and Makerere University College of Computing and Information Science. So those three individuals who you see there are our principal investigators. Each of them come from one of these three organizations. We are funded by IDRC Canada and FCDO. We also belong to the Artificial Intelligence for Development program in Africa, which is seeking to expand AI in different development sectors across the continent. So what do? Our goal is to catalyze the development, the research, development, and scale of responsible AI solutions that address MSRH challenges in sub-Saharan Africa. We target Anglophone and Francophone and Lusophone stakeholders. So we're trying to be as inclusive as possible across the continent. And we are looking for people who are working at the intersection of AI, MSRH, and also those two individual sectors themselves. We are very focused on having an ethical and responsible approach to the work that we do. And so when we are working with our partners, we provide funding and capacity building and methodological assistance with a keen focus on gender equity and inclusivity. We also, through our network, provide opportunities for networking and collaboration. So on the right there, you just see an image showing our values when we talk about responsible AI. So why is MSRH important? These are just a few statistics that I've got off the WHO and UNICEF website to share with you why it's important, what we are doing, and also what you're interested in participating in this Zindi challenge. So this first graph shows you the percentage of women who are attended to, who have antenatal care at least 4 times during their pregnancy. And the red means they have less antenatal visits. Green means they have more antenatal visits. So as you can see, there's more red in Africa and there's more green in Europe and Latin America. So this shows you that in Africa, we have women hardly attending antenatal care. And yet we know that the highest rates of early childbearing are found in sub-Saharan African countries. So we find that birth rates among adolescents in 2023 were 93 births per 1,000 girls. Then we also have a statistic called the lifetime risk of maternal death, which is the probability that a 15-year-old girl will eventually die from a maternal cause during her lifetime. As long as she's facing the current rates of fertility, mortality, and maternal death in her context, the chances that she will pass away during her lifetime because of maternal causes are what this is showing. And you can see that for countries like Australia, Western countries, there's really a low probability that someone will die from maternal causes. It's like 1 in 20,000. But when you come down to sub-Saharan Africa, you see that about 1 in 55 women is likely to die of a maternal health cause in her lifetime. And then the total fertility rate per woman, also is higher in Africa, as you can see from the dark color here. We also see that new HIV infection rates are highest in Africa and Latin America here. We also see that universal health coverage, which means that everybody is able to access basic healthcare, is most sparse in sub-Saharan Africa, as you can see from this gray color. And finally, we know that globally, more than 1 million sexually transmitted infections are acquired every day, and most of these are in Africa. And what's even more worrying is that a lot of these STIs are having rising levels of drug resistance. Mm-hmm. And why do we choose artificial intelligence as a solution for these problems? Because we find that in sub-Saharan Africa, there's this really rapid expansion of digital connectivity, mobile technology, and data systems. We have so many people using mobile phones. About 53% of people in Africa are unique mobile phone users, and 33% use the internet as well. We also find that digital health tools have been used innovatively for community health outreaches, and people are now starting to get used to the idea of digital health tools. There are also different strategies and policies and guidelines that have been released in the recent past. And finally, we are finding that ordinary citizens are increasingly adopting AI, especially since ChatGPT, ever since ChatGPT was launched. And so by July last year, 42.1% of Kenyan internet users, 16 and older, were actually using ChatGPT. So there's an opportunity there. So what's our contribution so far as Hash? We do research, like I said. So in terms of research, these are a couple of the studies that we've done. So we have a longitudinal qualitative study where we regularly touch base with members of the general population and expert stakeholders like yourselves to explore perceptions on opportunities, risks, limitations, and best practices for responsible AI in MSRH. And we found a lot of information from this that has guided many of the innovations and many of the approaches that we are taking as we do our work. And this is just one key quote that for us always resonates with us as a consortium. This is one of the quotes from, actually, this was an ordinary person, not even an expert user. And this was 3 years ago. They said the whole issue rotates around who is going to be the end user of the AI. So this is something we try to keep in mind every time. We've also had a crowdsourcing study, which is where we were enrolling people across the continent to give us questions on sexual health so that we could build a database that of question and answer pairs that could be used to build conversational agents across the continent. And actually part of the database that you're going to use for this challenge is from this crowdsourcing study. So this is the data set that we published. It has about 5,488 question and answer pairs that was validated by community members and by health workers, and it's available as open source on Harvard Dataverse. If you want, you can scan this QR code to get it. So we've also been funding innovators since we started. These were the sub-grantees we started out with in phase 1. They were 10 different organizations and individuals across 7 African countries, and each of them came up with an AI innovation addressing different issues. We have a number of chatbots, we had a number of predictive tools, and we also had a number of image analysis tools. Now what we're doing at the moment is we are working with our current sub-grantees from Kenya, Ghana, and Ethiopia to come together to co-create a multinational, multilingual conversational assistant. And our goals are to make it available in multiple languages. So now we're aiming for English, Swahili, Luganda, Amharic, and Akan. If you come from different parts of Africa, I hope you recognize some of these languages in your region. We also hope that it will have an offline capability. We've planned to have equity-centered deployment channels, so make sure that the ways that we've deployed it are accessible to, the people in the last mile. We're aiming to get to 25,000 participants. At the moment, we have already published our dataset, like I mentioned before, and we have a prototype of this that's out being tested. So we hope to launch it soon. Please be on the lookout. We also do some capacity building for innovators. One of them is the Zindi challenge. I won't talk about it because Claire will give more information. But we also have a hackathon that's ongoing at the moment in collaboration with APHRC. We started this 2 weeks ago now. That's when we got our teams. So they're working very hard to come up with different innovations around early pregnancy loss care and empowering informed contraceptive choices. So please be on the lookout for those tools when they're launched in July. We also do quite a bit of stakeholder engagement in different fora, but in particular, we have the Hash Network, which we created as our platform for collaboration, community, and capacity building. It was launched in December 2022 with our inaugural Hash sub-grantees at the time. Our value proposition is to create a collaborative network for developing resilient and sustainable systems for MSRH through responsible AI. We and members of this club are actually welcome of this network are welcome to join clubs around areas that they find the most important, and we are available to support them. So at the moment, we have 5 clubs, a GEI club, a dataset club, a scientific communication club, capacity building club, and a stakeholder engagement club. These regularly have activities or webinars, which anybody is welcome to join. We also have a strategic plan that we have recently launched to take us till 2030 because we believe in this network and we'd like it to continue to be available. So these are our focus areas for the next 5 years. So how can you be a part of Hash? You can sign up to be a network member. Like I mentioned, on our website, there is a link to sign up to continue to receive updates. You can also be part of this Zindi challenge if you have not already signed up to join, registered to join. And also you can look out for updates on the work that we do, but more specifically, the ongoing hackathon in collaboration with APHRC. We would really like to keep in touch with you. So please do follow us on these different platforms of ours. And we would be really grateful to engage. Thank you very much.
Okay, thank you very much, Dr. Oseku. That was very insightful and glad to see the kind of work you and your team are already doing. I don't know if there's a question before we move on, maybe a question or two, if you have any question. Okay, well, if there's no question, I'll give the floor to Claire so that she can talk a little bit more about the challenge and yeah. Okay. Okay, Claire, the floor is yours.
All right, thank you, Joel. Let me share my screen shortly. Oh, sorry. Stop sharing. Okay, I hope you can see my screen. Please confirm.
Well, we can see it, but it's not the full. Maybe you want to go full screen.
Okay. Two views.
Okay, I think this is much better. It's fine.
All right. Thank you once again. My name is Claire Babirye. As I've been introduced, I am a research scientist at the Center for Artificial Intelligence at Makerere University. And Dr. Elizabeth has given us a preamble on the HASH project, to which this challenge belongs. And so I will briefly talk about what the challenge is about, as well as the dataset, before I hand over again to Joel to take us through the next part of the agenda. So as we have already come across the challenge on Zindi, probably, we must have seen that it's titled as a multilingual health question answering challenge, specifically focusing on low-resource African languages. So the presentation is structured in this format: the motivation, the objective, the end users at the end of the day, how the dataset is organized or designed, as well as distributed among the different splits, and then the conclusion for this. Yes, so still like Dr. Elizabeth highlighted, the concept of where this particular challenge arises from. So the focus is on specifically maternal, sexual, and reproductive health, and looking at it on the health aspect, but also remembering the fact that we belong to different ethnicities, of course, which implies that we speak different languages. So at the end of the day, how are we able to ensure that we have access to information regardless of the language barriers that are existing? And so then the idea is, can we then be able to tap into artificial intelligence to be able to break down these different language barriers that are already existing, and then at the end of the day, be able to ensure that we have equitable access to this information that is needed by different communities within our continent. So the objective for the challenge is for us to develop a multilingual model. And the idea is that this model should be able to answer health-related questions specifically on these domains within health. So that is maternal health, sexual health, and reproductive health. And so in the aspect of it being a multilingual, we are specifically focusing on the English language, the Luganda language, which is one of the main languages within Uganda, Kiswahili, which is a regional language very common in East Africa, but mainly Kenya and Tanzania, but still the other East African languages make use of Kiswahili. And then Akan, which is a language in Ghana, and then Amharic, which is a language in Ethiopia. So while Dr. Elizabeth was presenting, she mentioned the different subgrantees on the HASH project. And so the subgrantees that were being referred to then are the ones that have contributed firstly in terms of developing data sets, for example, for Akan, for Amharic, as well as Kiswahili. And Kiswahili, in this case, so there is a data set that was collected from Uganda for Kiswahili, but then there is also a data set that was collected from Kenya. But for the Zindi challenge, I think as some of you might have already noticed from the data set itself, so the focus for Kiswahili is mainly for the data that was collected from Kenya. So yes, so the target end users still just to add on what was mentioned by the previous speaker. So because we are looking at maternal health, we are looking at sexual health, we are looking at reproductive health. And so within the aspect of maternal health, then that would imply that this information is relevant to a group of mothers who are expecting, for example, or mothers who have just come into this new role, and those are lactating mothers. And so you'd find that probably they need reliable information, of course, in the language that is convenient for them or the language that they can understand. And this could be about prenatal care, it could be about childbirth, and so on and so forth. So on the other hand, because we talked about aspects of reproductive health, so you'd find that this information is needed or is important for young people in the adolescent stage, because maybe they seek information that could be confidential to them. And of course, they need accurate information to do with sexual, information to do with reproductive, because then they would get some form of guidance along the way. And also, of course, on the other hand, this information would be important for health workers as well as NGOs, where we have community health counselors or organizations that handle patients specifically alongside these terms. And so they probably need multilingual tools for effective management of these patients. So these are some of the target end users. But of course, there could be others, but still within the aspect of maternal, sexual, and reproductive health. Then now to get into the data set, so maybe I will reference one of the previous slides. So the data set includes all these different languages that we are focusing on. In other words, we have data points within the English language, within the Luganda language, Kiswahili language, Akan, as well as Amharic. And so because the task is for us to have a sequence-to-sequence multilingual text generation problem, so the data set has been structured in that form. So when you go to the Zindi page, specifically on the data tab, you'll find that we have mainly 3 sets of data. So we have a training set, we have a validation set, as well as the test set. And for us on the developing side, by us, I'm referring to the participants in the challenge. So we are mainly using the training set and as well as the validation set, because for the submissions that we are making, then we would use the test set. Yeah. So, of course, as we are aware, the training set to support us in the development of the model, and then the validation set along the way to help us to be able to evaluate how the model is performing, and then probably think of different hyperparameter tuning techniques that we would want to employ to be able to better on the performance of the model. So it is structured in this way, so the sequence to sequence. So for each data point, we have a unique ID. So the unique ID is a string that includes the country where that specific data point came from, the language for this data point, and it also specifies, for example, there is a code for training, there is a code for validation, there is also a code for testing. And that means that all the data points within the training set for that specific code, it is the same. for all those different data points. And then the other is just an alphanumeric unique code that has been generated for that particular data point. So that is like the unique ID. And then there is a question. So this is the health question that we're referring to. So the health question could be on either about maternal health, it could be about sexual health, it could be about reproductive health, yes. But also maybe just to give more details on what is included, for example, in sexual health. So in sexual health, you'd find that we have information, or we have topics on sexually transmitted infections. So it could be maybe someone wanted to find out something to do about prevention, or maybe someone seeks information about treatment, or maybe someone seeks general information about STIs, or maybe someone seeks information about diagnosis, and so on and so forth. Yeah. So the coverage, or in terms of what in terms of the different subtopics that are covered. Yeah. So the different subtopics that are covered are to really enable these different target end users that we talked about be able to access the information that we think is relevant accordingly. And so for the training set and validation set, the corresponding output, which is the answer for this question, is given. So like Dr. Elizabeth mentioned, so these answers have been medically validated. And also the other variable that is included is a subset. So the subset mainly gives information on where this particular data point belongs in terms of language and country. Yeah. Then, so the difference between the training set, validation set, and the test set is that for the test set, what is required then is for us to be able to generate the answers, or to generate the predictions from the model. And so you'd find that the test set for it does not have the corresponding output. So that's why you see that for this particular set, we don't have a variable called output, because then this also speaks on what is required in terms of what we have to submit at the end of the day. Then this is just information on the sizes of the data sets. So I know Dr. Elizabeth mentioned the data set that has been published already, but like I mentioned, that also in addition to what the hash network has collected in terms of what has been published, so there is also this data set that has come in from the different sub-grantees of the hash project. And so for the training set, we have this cumulative that has been provided for the challenge, 29,000 data points, over 29,000 data points, sorry. And then the validation set, which is up to that size. And then the test set, we have these 2,618 questions only, to whom we should provide answers after we've been able to develop our models, right? Yeah, so in brief, that is it about the challenge, as well as about the data set. And of course, the goal is at the end of the day, can we have this chatbot assistant, or can we have this multilingual model that can then contribute to access of information in the language that is convenient to these different target groups that we have, but more importantly, the provision of appropriate responses, and appropriate in terms of accuracy, as well as in terms of ensuring that the language is preserved at the end of the day. Yeah, thank you. Back to you, Joel.
Okay, thank you very much, Claire, for taking us through the challenge and the goal behind it, so we can actually see how it fit in the whole picture. Now, I don't know. Are there any questions for Claire before we
Hello.
continue? Yes. Yes,
Yeah,
Amel.
yeah, it's the first time attending Zindi challenge, and I wanted to know, is it allowed to build a agent layer on top of the model we trained? Hello, Claire. Have you got my question?
Sorry, Faud, can you go again?
Okay, is it allowed to build an agent layer on top of the model we trained or we built? Is it allowed in Zindi challenge to produce a layer of agent on top of the models?
Okay.
Oh, okay, maybe I can take that. Okay, yeah, I'm assuming, have you joined the challenge yet? Okay, so basically, I mean, I'm going to mute Tunde. Okay, the challenge page specifies the type of output that is expected, right? When you sign on to the challenge, there is a leaderboard. A leaderboard shows the ranking. It's a way of scoring the submission that I made, and it's a way of tracking or showing you how you're doing as far as the challenge is concerned. So the output, the expected output is usually a CSV file. But at the end of the challenge, you will be expected to submit your code for review, code with documentation and everything. So yeah, you can have that there, but then what is submitted on the system for evaluation is just your CSV file with your prediction. So it will, in this case, it will be a CSV file where you have the ID column and the target column, i.e. the target column is just the answer corresponding to a specific question. Okay, I don't know if that answers your question. So yeah, whatever is done on top of the model is, I mean, that's subsequent. That's something that can be done after. But in this particular case, it's not a requirement. But then, of course, you're welcome to do that in your final submission. But it's not a requirement for the challenge. Okay.
Okay, thanks.
Okay, cool. Okay, any other question? Could you please share the slide here in the chat? Okay, I guess the question is for Claire and Dr. Oseku. Yeah, if that's possible, then maybe we can. I mean, of course, if the slide can be shared, then we can get them and post them on the challenge page later. Yeah, so I will let them answer that.
Joel, so would you like us to share the slides with you to post on the challenge page later? Which do you prefer?
Oh yeah,
Chat or
that's
the
perfectly fine. Well, yeah, you can share it in the chat here, and I will also post them on the challenge page, just so that those that are not here can still have access, and we can just have it there for everybody. Okay, thank you very much. Okay, do you have any other question? Oh, there's a question about data augmentation. Is any form of data augmentation allowed? I don't know if Claire, do you want to?
I think it depends on the developer at the end of the day. So I think if it's a technique that would work for them, then they can go ahead and augment the data.
Right. I joined the challenge. Is it too late to compete? No, it's not too late to compete. The challenge is still running. I think we still have a month, right? The challenge is still running till Yeah, exactly 1 month. The challenge will close on the 21st of June, so you still have time. It's not too late. Just to clarify, does the public leaderboard ranking depend only on the performance score of submitted file, or does the number of submission a team make have any effect? Well, the number of submission that you make doesn't have any effect. But then again, the idea of making multiple submission is just so that people can improve, right? Because the whole leaderboard, the whole idea of the leaderboard is to allow you to iterate and improve your solution. Because when you make a submission, you can see what your score is, and that gives you an idea of how well your model is performing. And then again, you have the public leaderboard and the private leaderboard, and this is done on purpose. So the public leaderboard is based on roughly 30% of the test set. And the private leaderboard, which is only revealed at the end of the competition, is based on the remaining 70% of the test set, i.e. there's a reference file which is kept on Zindi backend, and it has the answer to the question. So when you make your prediction, there are scoring metric. There is a way of scoring your submission to see how close you are to the the ground truth. And that's what gives you your score on the leaderboard. So it doesn't have the number of submission is just tell you how many times somebody made a submission. Of course, if your submission are improving, then your score should be improving. But there's no direct relationship between submission and number of. Okay, the 50 file submission limit is too tight. Is it possible to double it to 100? A bigger daily limit. Okay, well, I'll have to discuss that one with Megan, but I think right now we are keeping it at 50. Okay, but then I will bring that. I'll discuss that with her. People have been complaining about this. I will discuss that, and if the number of submission is going to be increased, then we'll make a post about it. But for now, you can consider that it stay the way it is. Okay. Any other question? Okay, good. The question about scoring. Okay, thank you for bringing that up. The question about scoring. So the scoring has been the issue around scoring has been resolved. So we had I think especially the Hodge score, there was an issue with tokenization, not with the score not handling tokenization properly as it should for some of the languages. So that has been fixed, but it's not yet deployed. So the engineering team is going to get that deployed probably tomorrow. I will make a post and the leaderboard will be rescored, but it has been fixed already. Thank you. Please, where is the link to join the challenge? Okay, I'm going to share the challenge link here and you can okay, yeah, so this is the challenge link. So when you go to Zindi, you can follow this link and you go to the page. Is the distribution of the data in the testing per country? Is the distribution of the data in the testing per country and language specific per language maintained consistent with that of the training and validation one? I am raising this question since there are more examples per some language than other. Yes, I mean this was taken into account while splitting the data set. So even though there are more examples than others, there is, the distribution is consistent. Okay. Yeah, exactly. That's correct. Yeah, it's stratified. Okay. Any other question? Okay, yeah. So the I know the question around the metric has been resolved. If not yet, it's not yet deployed, but that will definitely be done tomorrow. Please reshare the slide. Lost connection after the reconnect. Okay, yeah. Then yeah, the slide will definitely be posted on the challenge page after this. So don't worry if you didn't, you can. Okay. Okay, yeah, but I can. Okay, do you have any other question?
Hello?
Yes, iDevice.
I joined the challenge. I would like to know if there is any recommended models to fine tune, or it's up to me to just pick any model, or is it the case that there is a select few I can choose from that might assist the the training and progress in trying to compete, as opposed to saying I should go and fish in the sea.
Well, yeah, there is no specific requirement on the challenge page. So we didn't specifically put any requirement or restriction. So yeah, so it's really up to you. I don't know. That's the best answer I can provide. I don't know if that's sufficient.
All right, thank you. It's fine. I think it's fine.
One more question, maybe related to what has just been asked. So I believe there is different languages we are working with. So if I decide to use different models, is that also allowed, or are you looking for one model that can generalize to all the languages?
Well, I mean, the way you ensemble your model is really up to you, right? Usually when we have this type of, I mean, we usually don't have that constraint. So sometimes people have different approaches and they will ensemble model differently depending on what works best. So there's no restriction in place. So it's really up to you how you solve the problem.
Hi.
Okay.
Okay, Anthony?
Yes. Thank you. I think it's quite very clear. I just want to get some clarifications. Claire did talk about we need to produce an output in form of a chatbot. So I want to get clarification. Do we produce an app where we share the link with you guys at the end of the day, or you just need the model and the result?
Oh, okay. Well, that's sorry, Claire. Do you want to say something before I?
Yes, I could. Sorry. So for the challenge, I didn't imply that what is required is a chatbot. But from the presentation that Dr. Elizabeth made, so the idea would then be for us to have a chatbot, in a health assistant in form of a chatbot. But for this specific challenge, I think like Joel mentioned much earlier, but He's also going to take us through the submissions that are required at the end of the day. Yeah. So part of the submission will include the predictions that we've generated from the test set that we have already on the data tab on the challenge. And then also he mentioned that we will have to get access to the source code. Yes, but Joel can add on to that.
Okay, yeah. I mean, that was a great question. I mean, he's already thinking ahead in terms of deployment and the end user. I mean, which is always good. I mean, most often when we have this Zindi challenge, at the end, there is always the, I mean, obviously, you're welcome to, at the end of the challenge, sometimes we do have the introduction, right? So we will introduce the winners with the partners or the client involved in the challenge, and they can discuss their solution further, how they went about it. They can offer assistance in terms of implementation. So that's definitely something that can be done, but then we'll cross that bridge when we reach there. So it could be an opportunity to maybe connect with the Hash team and provide some assistance in terms of actually implementing your solution. So that's definitely possible. But as far as the challenge is concerned, it's really just, for now, we just focus on the model. But then again, when the competition ends, in the submission package, in addition to your model, there's also what we expect. We also expect documentation. So your code should be reproducible, the steps should be clear, and there should be some documentation explaining what you did. So those are things that are usually expected. Okay, yes, Suleiman. Sorry, you had your hand raised. It went down.
Yes, because I have to speak. That's why I lowered the hand. Can you hear me now?
Yes, we can hear you.
Hello. Okay, thank you. Well done for the exciting presentation. I need clarification on the targeted indigenous languages for the products. I'm not.
Oh, okay. Yes. So they are in the data set. You notice that we have 5 languages in the data set, right? You have Akan, you have Amharic, you have Luganda, you have Kiswahili, and you have English. So those are the languages in there. So for example, if a question is in Akan, then you also want the answer in Akan. I don't know if that makes sense. So whatever language the question is in, the answer should also be in that language. So it's a multilingual data set. You don't only have one language, but then you have 5 languages in there. Right. Should the bot be able to answer all relevant languages or almost to? Oh, well, the idea is that it should be able to answer everything, right? Because, I mean, yeah. So that's the end goal.
I'm not sorry. I'm sorry. A cockhead broke the line. Hello, can you hear me now?
Yeah. Yes, I can hear you. Yeah, let me go through it again. I think your question was about the languages and what it is. So as I was saying, the data set is multilingual. So you have a data set with 5 different languages. And it is, and if you look at the ID, the unique ID for each entry, you can actually figure out what language the question is in, because for Akan, for example, you have that string AKA, which means Akan, and the country is Ghana. And if it is Ethiopia, you have the code for Ethiopia, and you have Amharic, right? So there is Akan, there's Luganda, there's Kiswahili, there's English, and there's Akan. Those are the 5 languages in the data set. And it's question answer pair, right? So if the question is in Akan, the answer should also be in Akan. And if the question is in English, the answer is in English. Okay. Yeah, somebody is asking if Kaggle is allowed. Well, yeah, I will say yes, because unfortunately we don't provide computing resources. I mean, there are challenges where we have computing resources, but sometimes participants will download the data set and then they will use Kaggle infrastructure to solve the problem. And yeah, it's fine. It's really up to you. So you can, if you need to use Kaggle for the resources, then that's okay. Are we only restricted to use the provided training data to train the model? I don't know. Maybe I would say yes. Claire, what do you think about this? I mean, you can't.
Are we only restricted to use the provided training data to train the model? Well, I have colleagues on the call, but personally, I would say it is okay to look outside the training data, because I think the idea would be just to think back to the objective of the challenge, and maybe as the participants think of other sources of data set, then that would imply that the sources of data sets that they have thought about maybe contribute to maternal, sexual, reproductive in terms of increasing on the data set, but then also maybe think through, or just to ensure that the data set that they're going to use is reviewed at the end of the day in terms of the answers being medically correct or accurate. Yeah, so I think in terms of using other training data points aside the ones that have been given, I think it's okay. That's what I think. I don't know what Patrick and Simon think. They're on the call.
I mean, obviously, whatever data source you're using should be publicly available. So nothing that is should be publicly available, and you should provide all the instruction and code or whatever sources. So it should be clear where you got the data from, meaning everybody else should be able to access the data, and you should be, yeah. Okay. I just joined and missed most of the presentation. Will you provide? Yes, there will be a recording, so it will be probably be posted tomorrow. Yeah, there's a recording. Michael?
So my question is, I'll accept the previous question saying I want to ask that if we support for specific knowledge.
Oh, sorry, I can't. Yeah, your connection is. Yeah, I can't hear you clearly. Can you maybe repeat what you were saying? Oh, okay. Well, yeah, there's a starter notebook. Yeah, and I actually uploaded it to the competition page. Yeah, we'll discuss it briefly. Okay. Yeah, if there is no other question, we can have a look at the starter notebook. And yeah. Okay, well, I mean, the competition has been open for a month. People have been competing. So by now, almost everybody, a lot of people have been making submission, which is good. And yeah. Again, in terms of your model, it's really up to you, right? There is no restriction. So whether it's distillation technique or whatever approach you're using, that's fine. There is no. Okay. Yeah, I will briefly share the starter notebook. Okay, I think it's still. Wait, let me just make sure I'm sharing the right screen. You able to see my starter note, my collab notebook?
Yes, we have you.
I might not be sharing the right screen. Oh, okay, okay, then that's great. Okay, this notebook is available on Zindi, and you should have access to it. I mean, you should have access to it on the challenge page. If when you go to the data tab, it's available there. Basically, I mean, the whole point of this starter notebook is just to get you started and show you how to make a submission. This is by no way an optimized model or whatever. It's just a baseline. Okay. So obviously, I start by importing some libraries. I'm loading the data, right? Here you can see my the train set, the test set, the validation set, and the sample submission file. Again, the sample submission file shows you the structure that is expected for your submission, i.e. the ID and the target column. Right. And these are just some parts for my output, right? Basically just loading the data, checking the size, displaying some rows just to have an idea of what the data is. And you can basically see here, this is what Claire was talking about. You have the ID, the unique identifier. This is the training set. So you have TR, that's for training, TS is for test. And in this case, this entry is Akan. So the language here is Akan. And Akan is a language spoken in Ghana. So you can see the code there. And again, this is basically what you have in the subset column. So that's kind of redundant. But then again, we just had it there. So you don't have to extract that information from the ID. But it's there just to tell you, just to give you an idea of what the language is. So this is Akan and there's the output. So the input is the question and the output is the answer. Okay. Now again, this sample submission file just has some. Okay. Oh, then maybe there's something okay, the output here, there's the output, but then in the sample submission file, you will see that we are calling it target. We are calling it target instead of output. And we have the same column duplicated 3 times. That's just, we do that just so that, I mean, the evaluation metric here, the evaluation metric for this challenge is we are using multi-metric evaluation, and there are 3 metrics that are used, right? And for each metric, you need a column. So that's just the way the scorer is set up, because then the column will be dispatched and each column will go to a specific metric. So yeah, so it's the same column duplicated 3 times. So the value should be, I mean, the answer should be exactly the same. Of course, these are just placeholders, so that's what the sample submission is. Okay, yeah, this is just to, again, this is what you will see in the data. the distribution. Some languages have more entry than others. Yeah, again, mapping just to make things clear: English, Akan, Luganda, Swahili, and Amharic. Okay, yeah, there is no empty entries, right? So this should return the same number of rows. This is just, this is just for scoring here, not nothing that you should worry about. Yeah, and again, this part here is just it's just some basic model based on term frequency inverse. Yeah, just trying to, generate answer based on the similarity, how close the question in the test set are to the trend set. That's basically what this is doing. Of course, this is not going to give you anything. It's not going to perform as well as you want, but then it's just a starting point. The whole point is just to generate the submission file. And yeah, and there is, so it's evaluated, the model is trained here with the trend set, and it's used on the validation set and on the prediction set. And it's used on the test set to make prediction and score the prediction based on the, no, not on the test set, right? This is actually on the validation set, because for the validation set, we actually have the answer. So we can just score and see what score we get. So so this is what is being generated. So you see here, for example, this is the baseline answer. So this is the answer in the validation set. Oh no, the output is the answer in the validation set. And the baseline answer is the answer that my model generated. Okay. Simply by trying to match, how similar the questions are. And again, I will then use this to, so this model is trained, I can use it to make prediction on my test set. And when I make, these are the prediction that I made on my test set. And I can then, okay, I will just go down here. Okay, right. And I can save the prediction, right? So what I end up doing is, because I want the output, the CSV, to have this format where I have the ID and I have the 3 targets. So I'm taking the prediction. So this function simply save the prediction in that format. So you then have something like this. You then have something like this, and you can download, and you can basically download this folder, and you can download this file, and you can submit it to Zindi, and you get a score. So I tried this basic model. I also tried some LLM. I also tried some large language model, and yeah. So that's basically what the, so again, the starter notebook shows you how to load the data, how to prepare your samples, how to prepare your submission file. So when you're done, you can download this CSV file and you can submit it to Zindi and you get a score. Right. I think I also went through some fine tuning here, trying to fine tune this model just to see if I could improve my score. Yeah, that's basically it. Again, the notebook is available on Zindi and you can download it, you can have a look. Yeah. Okay. Yeah, that was fast. I don't know if there's any other question.
Sorry, it was not quite clear when someone asked if we could have like different models answering the different questions, or we just having one model generalize on all the questions.
Yeah. Okay.
All the
Yes. So
languages.
yes. Okay. Yeah. My answer was that it's really up to you, right? There is no restriction. Like, you have to solve the problem the best way you can. So if you need multiple model, that's fine. You can have some ensemble, whatever. It's really up to you. Yeah. So I hope
Okay,
that answers
thanks.
your question. Yeah.
Yeah, sure. Thanks.
Oh, how is Roach score handle for Amharic? Okay, yeah, we deal with that by not, so we are not using the default tokenizer. So tokenization is done just at word level. So we're not, the default tokenizer was kind of messing it up. And yeah, so that's resolved. Okay, I think okay, and I think I'm not going to answer the question about the LM George. Oh, well, you're talking in terms of criteria. Well, obviously the answer should be accurate, right? The answer should be, so there are just some, I would just say the criteria are kind of, yeah, I think the criteria are all stated on the challenge page in terms of what is expected. In terms, yeah, the answer should be factually accurate, the language appropriateness, those type of things. Yeah. Okay. Well, yeah, I think we can stop here. Okay. Thank you very much, Claire. Thank you very much, Dr. Oseku, for your time, and thank you. And thank you to all those who could make time tonight to be with us here, and yeah, for all the question and everything. And yeah, now it's up to you. We can't wait to see what you come up with, your different solution. And yeah, there's still 1 month to go, right? So you still have time to improve your model, and yeah. Okay, cheers. Okay, good night. Bye-bye.